Here at the Shriners Hospital for Children, Dr. Stephen Liggett, Director of USF Health and Personalized Medicine, is going to tell us how in the future you can be diagnosed and treated on a genetic level. A few months ago, Dr. Liggett was a researcher and professor at the University of Maryland, but now he has his own lab at the University of South Florida to continue his research of personalized medicine.
Personalized medicine is the use of an individual's genetic makeup to guide medical care in a way that standard laboratory tests or medical history cannot. The things that personalized medicine can do really break down into three components. One is it can predict who in the future will get a given disease. Secondly, it can provide an idea once someone has a disease as to the severity and the course of that disease. And third, it can provide guidance as to the proper drug treatment for a given disease. With that in mind, it is amazing to think that basically all we need is a single tube of blood from which we extract the DNA. And since your DNA never changes, then basically you have a permanent sample available for interrogation, as we would call it, as new discoveries are made. But to me, it's really obvious and intuitive. So you can have two neighbors that both have, let's pick a disease like high blood pressure, and they can be talking across the fence, and one says, well, I can't take this medicine because it makes me dizzy, and by the way, it doesn't really lower my blood pressure, and the other one says, but this one's perfect for me. So if you were to ask those two people, I wonder why this is the case, the first thing they'll say is, well, we have different genetic makeup. I think my experience from taking care of a lot of patients showed me that it was necessary to move away from the one-drug-fits-all mentality, which is what most of medicine had been founded on for many, many years, to more of a individualized approach to taking care of patients. So there are several approaches to instigating personalized medicine within a healthcare system. And my goal would be that most patients who come to see us, whether it be in our inpatient services or outpatient services, will provide a sample of DNA so that we can begin the process of both helping to get their medicines right the first time, or helping them to understand how their disease will progress, or giving them an indication that they're at high risk for a certain disease, and they can modify their diet and other environmental factors to make the best of the situation. I think it's important to emphasize that genetic testing, like we're talking about today, does not replace physician judgment and is not going to set up a healthcare system where you never need to see a human being. You just give your blood to a machine and then everything is taken care of. It's not going to be that way. So what we're talking about is using genetic testing as part of our standard laboratory tests that we already get, chest x-rays, the usual things, and a good physical examination and a good medical history, and merging all those together so that we can come up with better care than what we have now.
For more information on Dr. Liggett's research or USF Health, visit the website. For Spotlight Tampa, I'm Caroline Metell.